So as you may already know, nephron is the structural and functional unit found within the kidneys. Each nephron has 5 distinct regions that have specific function. First, we have Bowman's capsule, surrounding a network of capillaries called glomerulus. Here blood comes in through the afferent arteriole, where components of the blood get filtered out of the capillaries into the capsule. Filtered blood is then carried away from the glomerulus by efferent arteriole. Next, glomerular filtrate, which contains mostly water, amino acids, glucose, sodium bicarbonate, and electrolytes, flows through proximal convoluted tubule. In this region, almost 100% of the amino acids, glucose, and about 90% of bicarbonate get reabsorbed, as well as about 65% of electrolytes such as sodium and potassium, along with water. As a side note here, remember, wherever sodium ions go, chloride and water tends to follow. The next major region through which the filtrate travels is the descending and ascending loop of Henle, which passes into the medulla of the kidney. Now, the descending limb has walls permeable to water, but impermeable to sodium. So as the filtrate travels down, water leaves, but sodium tends to stay, making the filtrate more concentrated. On the other hand, the opposite takes place in the ascending limb, particularly in the thick limb, which is permeable to sodium, but impermeable to water. So as the filtrate travels up, about 25% of sodium gets reabsorbed passively, as well as via active reabsorption mediated by the sodium-potassium 2-chloride cotransporter. Next, the filtrate travels through the distal convoluted tubule. Here, about 5 to 10% of sodium chloride gets reabsorbed mainly via sodium chloride cotransporter. This part is also relatively impermeable to water, so at this point the filtrate becomes more diluted. Finally, the filtrate travels through the late distal tubule and collecting duct. Here we find 2 types of cells, the principal cells.
So diuretics are the drugs which will be prescribed to any individual who is being diagnosed with the edema or increased fluid accumulation in his body and is not being able to excrete from his urinary system. So diuresis is a condition in which the kidney filters too much body fluid. So that increases your urine production and the frequency with which you need to use the bathroom frequently. So in simple words, I'll be explaining that is, so with a highlighter, yes, red color. So this is a human. So he is having 2 arms, 2 legs, and he is having edema. Fine. So he is having edema and his weight has increased to 80 from 60. Now doctor is prescribing him diuretics and now he'll be excreting urine 6 to 10 times a day. Usually, for example, you will be excreting urine 2 to 4 times a day, but this guy will be excreting 6 to 10 times a day because he's been prescribed with diuretics. Fine. So this kid is sitting over a toilet. So this kid has been prescribed furosemide as Lasix. And one more example, this is a panda who is urinating frequently 4 to 6 times in a day because he has been prescribed a diuretic drug because he is having edema all over the body. Fine. Antidiuretics. So usually we have seen what is diuretic. So in diuretic prescription, you will be excreting more urine in your day-to-day life for more than 4 to 6 times. But in antidiuretics, your urine excretion will be reduced. So that is antidiuresis drugs reduce urine volume. So For example, we can take vasopressin. So whenever this vasopressin is prescribed, so you will be urinating once or twice in a day. So classification of diuretics, which is very important in uh, exam point of view. They'll be asking you in a 15-mark question. First one, that is high efficacy diuretics. First classification. So first one is loop diuretics in high efficacy diuretic. So for example, furosemide and torsemide. So Lasix, you will be knowing furosemide as a Lasix. It's a brand name. Second one is medium efficacy, that is thiazide diuretics. Examples, you can have indapamide or hydrochlorothiazide or chlorothiazide. So third one is low or weak efficacy diuretics. So first one is carbonic anhydrase. So for this example, that is methazolamide, and B, that is potassium sparing. Example, that is spironolactone, and C, that is osmotic diuretics, that is mannitol. These are, like we can see, this is a fixed things that you need to by heart. There is no other choice, you need to by heart. First one is classification of diuretics. First one is high efficacy diuretics, loop diuretic. Second one, that is medium efficacy diuretic, thiazide. Third one, low or weak efficacy diuretic, that is carbonic anhydrase, potassium sparing, osmotic diuretics. You can remember these three: high efficacy, medium efficacy, low efficacy, and remaining you can write loop, thiazide, carbonic, potassium, and osmotic. So furosemide is one of the very important question which will be asked in 5 marks. So you need to know what is clinical pharmacology of the furosemide. That is nothing but mechanism of furosemide. So furosemide is a potent diuretic. As we all know, what is diuretic? Increased urine excretion that inhibit the absorption of sodium and chloride in the proximal and distal tubules and the loop of Henle. We all know. I will show you in the diagram itself. For example, see, this is Bowman's capsule. From here, this is proximal convoluted tube, and like this it will be adverse reaction. So first adverse reaction is gastrointestinal system. So in gastrointestinal system, we can see diarrhea and constipation and nausea and vomiting. So nausea is vomiting sensation. So second one we can see in central nervous system, that is dizziness, headache, blurred vision, and dermatological hypersensitivity reaction, that is exfoliative dermatitis. And last one is cardiovascular reaction, that is orthostatic. So what is the mechanism of diuretics? First one is osmotic diuretics. You need to remember this. Second one is loop diuretics. Third is thiazide diuretics, and fourth is potassium sparing. So potassium sparing, which will spare potassium, which won't excrete potassium. So osmotic diuretics, what is the mechanism of action? So whenever we will be prescribing osmotic diuretics, so usually the person or individual will be having increased blood glucose because there is more accumulation of water or fluid in the body itself. See, this individual having two legs, two hands, he is having edema all over the body, and because of accumulation of fluid in his body, there is increased blood glucose in his body. Definitely more volume of blood means there will be increased glomerular filtration, and there will be increased glomerular filtration of glucose too. When we prescribe this osmotic diuretic, this will create an increased osmotic pressure in the renal tubular fluid. Because of this increased filtration also there will be increased osmotic pressure, and after providing this osmotic diuretic, the pressure will be increased and there will be more water, reabsorption won't be there. It means less water reabsorption. So osmotic diuretics will help us to excrete more urine. Fine, that's it. So in loop diuretics, the mechanism of action of loop diuretics is, so it is being performed in the thick ascending limb. So this is Bowman's capsule, and all over this is diagram. So Bowman's capsule and proximal convoluted tube, loop of Henle, thick ascending limb, and this is distal convoluted tube. So this loop diuretics is acting in this thick ascending limb. Now what happens, this sodium, potassium and chloride is being inhibited and is excreted in the urine itself, and it is not being allowed to enter the body. This is body. So this is body side. Fine. This is excretory system side. So when this water is traveling like this and it is being in this, sodium and potassium and chloride is excreted and it is not allowed to enter the body. Fine. So the mechanism of action of loop diuretics is to inhibit sodium, potassium and chloride and excrete in the urine. As a diuretics, mechanism of action of thiazide diuretics. So in this you need to know what is the mechanism. Fine. So it happens in distal convoluted tube. You need to know basic things. Bowman's capsule, then proximal convoluted, loops of Henle, ascending limb. This is distal convoluted tube. In this region, this mechanism is carry over. Fine. So what happens is, in distal convoluted tube, the sodium and chloride has to be absorbed and sent over to the blood. This is normal, fine. But what happens in the diuretics, thiazide diuretics, this sodium and chloride is being not absorbed into the blood and it's being excreted. See, excreted, excreted. This is the mechanism in the distal convoluted tube by the thiazide diuretics. That's it. So potassium sparing diuretics, you need to know what is the mechanism of action. So as you have seen in the title itself, potassium sparing diuretics. Sparing is nothing but it, in this diuretic it won't secrete the potassium, it will save. Sparing is, you can also known it as saving the potassium into the body itself. This potassium won't be excreted. Fine. It will be saved into the body, into the interstitium blood. That's it.